Symptoms of diabetes. A skin wound that doesn't heal, heals slowly or heals but tends to recur, is known as a chronic wound. Some of the many causes of chronic ongoing skin wounds can include trauma, burns, skin cancers, infection, or underlying medical conditions such as diabetes. Wounds that take a long time to heal need special care. Nausea is feeling an urge to vomit. It is often called being sick to your stomach. Vomiting or throwing up is forcing the contents of the stomach up through the food pipe esophagus and out of the mouth. Blurred vision can be caused by eye conditions, including difficulty focusing your eyesight, such as with nearsightedness or farsightedness. Astigmatism, when the surface of the eye isn't curved properly. Presbyopia, when your eyes find it harder to focus as you age. Dry eye syndrome, lacking strength, such as A. Deficient in physical vigor, feeble, debilitated. B. Not able to sustain or exert much weight. Pressure or strain. Hunger is an uncomfortable or painful physical sensation caused by insufficient consumption of dietary energy. It becomes chronic when the person does not consume a sufficient amount of calories, dietary energy on a regular basis to lead a normal, active, and healthy life. The urge to drink too much may be the result of a physical or emotional disease. Excessive thirst may be a symptom of high blood sugar, hyperglycemia, which may be due to diabetes. Excessive thirst is a common symptom. It is often the reaction to fluid loss during exercise or to eating salty foods. Frequent urination is the need to pee more often than average, 7 to 8 times throughout the day. It can happen to anyone, but it's more common in people over the age of 70, pregnant people, and people with an enlarged prostate. The most common cause is urinary tract infections. Tingling in the feet or hands may feel unpleasant, but the cause is not usually serious. However, severe or persistent tingling may be a sign of an underlying condition, such as a pinched nerve, a vitamin deficiency, or diabetes complications. Dizziness is a term that describes a range of feelings, such as feeling unsteady, woozy, weak, or faint. It is something that most people may experience from time to time. It is rarely the sign of a serious problem. Dizziness has many possible causes, including inner ear disturbance, motion sickness, and medication effects. Sometimes it's caused by an underlying health condition, such as poor circulation, infection, or injury. The way dizziness makes you feel and your triggers provide clues for possible causes. High blood sugar hyperglycemia is where the level of sugar in your blood is too high. It mainly affects people with diabetes and can be serious if not treated. People with diabetes can also have blood sugar that's too low. This is called low blood sugar. Hypoglycemia. What happens when your blood sugar is high? Tiredness, blurred vision, unintentional weight loss, recurrent infections such as thrush, bladder infections, cystitis, and skin infections. Fatigue is a feeling of constant exhaustion, burnout, or lack of energy. It can be physical, mental, or a combination of both. Fatigue can affect anyone. Most adults experience it at some time in their life. Each year, many Australians see their doctor about fatigue. Fatigue is a symptom, not a condition. What is the cause of the fatigue? Most of the time, fatigue can be traced to one or more lifestyle issues, such as poor sleep habits or lack of exercise. Fatigue can be caused by a medicine or linked to depression. Sometimes fatigue is a symptom of an illness that needs treatment. Dry skin causes your skin to have a rough texture because it doesn't have enough moisture. Dry skin is very common. The medical term for dry skin is xeroderma. You can treat dry skin at home by using moisturizers. Talk to a dermatologist if you have dry skin that doesn't go away or keeps returning. A vaginal yeast infection is a fungal infection that causes irritation, discharge, and intense itchiness of the vagina and the vulva, the tissues at the vaginal opening, also called vaginal candidiasis. Vaginal yeast infection affects up to 3 out of 4 women at some point in their lifetimes. Many women experience at least 2 episodes. A vaginal yeast infection isn't considered a sexually transmitted infection, but There's an increased risk of vaginal yeast infection at the time of first regular sexual activity. There's also some evidence that infections may be linked to mouth-to-genital contact, oral genital sex. Medications can effectively treat vaginal yeast infections. If you have recurrent yeast infections, 4 or more within a year, you may need a longer treatment course and a maintenance plan. What are the types of sexual dysfunction? Desire disorders, lack of sexual desire or interest in sex. Arousal disorders, inability to become physically aroused or excited during sexual activity. Orgasm disorders, delay or absence of orgasm climax. Pain disorders, pain during intercourse. What are the 5 sexual disorders? The 5th edition of the DSM-5 includes female sexual arousal, interest disorder, female orgasmic disorder, genitopelvic pain, penetration disorder, male hypoactive sexual desire disorder, erectile disorder, premature early ejaculation, and delayed ejaculation. Why am I suddenly gaining weight? Weight gain and short-term fluctuations may happen for a variety of reasons, such as aging or making lifestyle and dietary changes. However, fast weight gain can be a sign of an underlying health condition, such as a problem with the thyroid, kidneys, or heart. What are the signs that you are gaining weight? 10 signs your weight might be increasing. Chronic exhaustion, trending now, increased cravings, craving for desserts and sweets, and a significantly increased appetite could be a symptom of weight gain. Rising parameters, increasing waistline, lethargy, snoring at night, stretch marks, swollen sore feet. What are signs you lost weight? 10 signs you're losing weight. You're not hungry all the time. Your sense of well-being improves. Your clothes fit differently. You're noticing some muscle definition. Your body measurements are changing. Your chronic pain improves. You're going to the bathroom more or less frequently. Your blood pressure is coming down. Weight loss, unintentional, feeling depressed, cancer. Even when other symptoms are not present, chronic infection, such as AIDS. Chronic illness, such as COPD or Parkinson's disease, drugs, including chemotherapy drugs and thyroid medicines, drug use such as amphetamines and cocaine, stress or anxiety. Eye diseases that can affect people with diabetes include diabetic retinopathy, macular edema, which usually develops along with diabetic retinopathy, cataracts, and glaucoma. All can lead to vision loss. But early diagnosis and treatment can go a long way toward protecting your eyesight. Is eye damage from diabetes reversible in later stages? It's important to start treatment right away, especially if you have changes in your vision. While it won't undo any damage to your vision, treatment can stop your vision from getting worse. It's also important to take steps to control your diabetes, blood pressure, and cholesterol.